Michael Beaver. I'm the CEO at Northeast Methodist Hospital. Tonight we're celebrating our Joint Replacement Academy reunion. We have dinners on a quarterly basis and invite graduates of our program back just to break some bread and visit and hear about how their lives have changed since they had their surgeries here at Northeast Methodist Hospital. This is one of my very favorite events that we do. We see hundreds of patients here every single day, and they're discharged and they go home and they go back to their lives, but we often don't get to see them again. And this is different. This is where people come back a few months after they've had a life-changing experience by having a knee replaced or a hip replaced, and we get to hear about how their lives have changed. And again, just tonight I've been able to go around the room and visit with many of the people here and hear about how they are playing with grandkids they didn't know that they'd be able to play with anymore, and how they're gardening and didn't think they would get to do that anymore, and how their lives have completely changed. I have a few folks that didn't know how to salsa dance before but want to learn now and didn't think they'd ever get that chance. So this is really one of my very, very favorite events. Love coming to this. As a leader in the hospital, this kind of event fills my cup because we get to hear long after they've been discharged from the hospital, long after they've been through the Joint Replacement Academy, about the impact it really had on them and the impact that our caregivers had on their lives and their families. It's really rewarding. You know, one of the ladies I was talking to tonight was telling me how this is, for most people, an elective procedure. They have pain, their quality of life isn't great, and ultimately they have to decide to get this done. Unlike somebody that comes to the emergency department that fell off the ladder, most of the patients here electively decide to have this done to improve their quality of life. And so I think that makes it a little bit different. And I think the expectations they have with that are a little bit different as well. They're expecting to have a better quality of life. And it's really nice to see that we're able to follow through on that and help them achieve their goals and meet their expectations. The team we have in the Joint Replacement Academy is outstanding. The physicians that we have in this program are phenomenal docs, not just great quality surgeons and great quality clinicians, but really great people. The therapists that we have, I love hearing them talk about Frank and the pain that he puts them through. And it's humorous to me because it's universal that at some point during their experience they don't like Frank at all, but by the time they leave they absolutely love Frank and love the rest of the team and understand why they had to do the things that they do and how that has really impacted them and given them a much better outcome at the end of the day.